review of what's being discussed. So, and listen, I really do want to thank you for being here. I realize there's a lot of disagreement in the room. I do get that. But I think that's okay. And we want to listen and we want to hear from each other. So please be respectful of each other. Because I realize there's a difference. There's a question, is Congress going to be part of the health care plan? I'd be happy to be part of the health care. I'd be happy to be part of that. Right now, because I had a guy come up to me at St. Teresa's Festival last night trying to explain to me the health care coverage that I currently have. The health care coverage I currently have is the federal health plan. It covers all federal employees. That is the same with my federal retirement, FERS. Now, I know there's a lot of myths out there, and I learned the truth when I was elected to Congress, that in terms of health care, in terms of retirement, you're treated just like any other employee in the federal government. But I would be happy to sign up for the public option, and if that happens,
That's what you wanted. We're good again for the questions. Why didn't answer them? That's what you wanted.
Put it in writing, you'll pay with our plan.
how can we false claims, the anti-healthcare reform ads? Look, folks, I don't know who runs those ads. Unfortunately, as an elected official, I have no control over ads that are run on either side. I would encourage you to seek information from all kinds of different sources and try to understand all sides. What I would really like to do, and I realize we've asked that we submit questions, but I would like to hear perspectives. If you have particular stories with healthcare, I know you're worried about opening things up. Again, I would ask you to be respectful. And I really want to hear about healthcare. I want to hear about your concerns with the plan. I want to hear about your concerns with what you have right now. And if you're a small business owner, I'd like to hear from you as well about whether or not you can pay for health insurance for your employees and for what you're looking at. The concern is about socialized medicine. I can tell you that I was at a pediatrician earlier today, and he told me that he believes our system to be immoral. I'm just telling you what I hear, all right? Because really, I am happy to engage in a conversation. I'm happy to hear from everybody, but it's tough when people are yelling. And I'm just telling you what the guy said. He was recently in Ireland. And in Ireland, if you are a resident of Ireland, you've got health insurance. And you're covered if you go to see a doctor. You're covered if you go to a hospital. Now, I understand that people have very real concerns with nationalized plans, with the Canadian system, with the British system. That's why this is not that. We could have just as easily be considering a bill that's single payer, but we're not considering a bill that's single payer. If you read the CBO analysis, which I encourage you to do, the CBO projects that the number of people participating in private plans will dramatically increase under this bill. mind standing up and explaining the situation? Self-employed electrical contractor? Please. Could you help me with your situation? I don't mean to embarrass you.
That's all right. Our premium goes up every October over $100 each year. With no indication, no use of medical insurance. We hardly ever use it. I started out at like $500 a month or a month. Now it went up to $900 a month.
And you're self-employed?
I'm self-employed, just my family. And I had to raise my deductibles just to get the premium.
Right.
Just to keep that right.
Under the plan, the way the exchange is being structured, you as a self-employed individual would have the ability to buy into any one of these plans under the exchange. Now, under the exchange, like I said, there are several tiers in terms of the type of coverage you want. If you just want catastrophic coverage and still allow for well visits, that's fine. If you wanted to cover dental, vision, and other things, that's going to be a higher cost. And that's also where the public option is in the exchange. So you can choose to, you can sign up for the public option if you would choose to do that. Now, for lower income families, it's graduate. The public option provides the benefit of a credit for lower income families, depending upon how much you're making and how big your family size is. So that's also a difference in that. Now, the way it is currently structured, the way the public option costs are going to be held low is because they have the ability to negotiate with the pharmaceutical companies, and as do the healthcare companies, or as do the health insurance companies right now. So that's the way we're trying to keep it low. What we have said and what's in the legislation, that has to be fully paid for through premiums. My challenge with this is this, and it's not so much for the self-employed individuals as it is the small business owner. And that's why I'm really curious if there are any small business owners in the audience. Because small businesses negotiate their health care, all right? And they negotiate it based upon the number of employees and those families and the size of those families, depending upon the situation. My concern is this: if you negotiate a price, right now the bill reads that any employee that works for you could buy into the exchange. Now, just thinking about it, it seems to me that then doesn't allow the employer to continue that same contract because the parameters of that contract have changed. You're a small business owner, can you help me with that?
Very concerned that we're going to have a double-digit expense for my business, which we put it at almost $500,000 for my renewal this year. And I have a little over about 140 employees for $500,000. What that forces me to do as an employer is to cost shift that expense to my employees, meaning
Hello.